I'm Leena Meriläinen. I work at ADN as a medical science manager. I'm responsible for scientific affairs in product management and marketing. For example, I gather and maintain scientific information regarding our QuickRead Go point-of-care analytes. I'm mainly focusing on C-reactive protein, CRP, which is a common infection marker, and especially that how it helps to reduce unnecessary antibiotic prescribing and prevent development of antibiotic resistance. Antibiotics are very important drugs to treat bacterial infections. Antibiotic resistance means that bacteria develop resistance against these drugs and therefore they became ineffective. Antibiotic resistance is a natural process in nature, but over a misuse of antibiotics in healthcare and in agriculture has enhanced the development of these resistant bacteria. Currently, antibiotic resistance and more widely antimicrobial resistance is an emerging global health threat. It's estimated that resistant infections will cause more deaths than cancer by 2050 if nothing is done. Antimicrobial resistance affects the whole human society, but maybe it's easiest to understand that many easily treatable infections may become life-threatening, which was the situation before antibiotics were discovered. Then, for example, surgeries and operations such as cesarean sections may become very risky because antibiotics are used to manage post-operational infections related to them. In general, resistant infections are more difficult to treat, patients are sick longer, and also the treatment is very expensive. The point with antibiotics is not that they shouldn't be prescribed, but the point is that they should be prescribed for those patients who really benefit from the treatment. For example, with respiratory infections, it's still very common that antibiotics are prescribed, although most of the infections are caused by viruses and cannot be treated with antibiotics. ADN manufactures, develops and sells CRP point-of-care tests that physicians can use as an aid to evaluate disease severity and guide appropriate antibiotic prescribing. There's a lot of scientific evidence to show that CRP point-of-care testing reduces unnecessary antibiotic prescribing significantly, and it's a key player in prevention of antibiotic resistance.